Okay, imagine this. One moment you're going about your day, and the next, silence on one side. The world around you just goes quiet. Now, this isn't just some minor inconvenience. We're talking about a true medical emergency where every single hour, even every minute, can make all the difference. Today, we're diving into sudden hearing loss, and trust me, understanding this stuff is absolutely crucial.
And that's exactly how it feels for so many people. It just comes out of the blue. 1 minute, everything's totally normal, and the next, half your world just fades to silence. It's disorienting, and you know what? It's frankly terrifying. So, what is actually happening inside your ear? And maybe more importantly, what on earth are you supposed to do about it?
Okay, let me be absolutely crystal clear on this, because if you take away only one thing today, let it be this. A sudden, unexplained loss of your hearing is a medical emergency. Full stop. This is not a wait and see what happens kind of thing. This is a get up and go now kind of thing.
So, to really get why it's so critical to act fast, we need to understand what's actually going on inside the ear. See, there are two main types of hearing loss, and being able to tell them apart, well, that's the first and maybe the most crucial step in trying to save your hearing. All right, think of your whole hearing system like a rock band. First up, you've got conductive hearing loss. This is like having a broken drum kit. It's a mechanical problem, right? Could be a bunch of earwax, some fluid, maybe a hole in the eardrum. The drummer is ready to go, totally fine, but his instrument is busted. The good news? We can usually fix the instrument. But then you have sensorineural hearing loss, and this is a whole different beast. This is a problem with the drummer themselves, the super delicate inner ear or the auditory nerve. And once that drummer leaves the stage, it's incredibly hard and often totally impossible to get them back.
So that's the emergency we're really focusing on today, sudden sensorineural hearing loss, or SSNHL for short. Now, there's an official medical definition for this, and it's actually pretty easy to remember. It's called the rule of threes. It means a loss of at least 30 decibels, happening across 3 consecutive sound frequencies, all within a 3-day, so a 72-hour period. That's the specific pattern that should set off all the alarm bells. Okay, so let's say you suspect this is happening to you, or someone you know. What do you do? I mean, knowing the definition is great, but having an immediate, concrete action plan, that's what really, really matters.
Right. This needs to be your playbook. Step 1, you have to see a doctor in person. Immediately. This is non-negotiable. A virtual appointment just won't cut it, because the doctor can't look inside your ear over a video call. They need to do a physical exam and otoscopy to rule out the simple stuff, the broken drum kit problems, like a giant chunk of earwax. And if they look in there and don't see anything obvious, that brings us to step 3, and this is vital. You have to push for an urgent audiogram. That's a formal hearing test. It's the only way to get the real data and confirm what's going on.
Okay, so here's a bit of a counterintuitive question for you. When a doctor looks inside the ear of someone who's just suddenly lost their hearing, what's the single most alarming thing they could possibly see? You might think an infection, right? Or maybe a hole in the eardrum. Nope. The most alarming thing they can see is a completely normal-looking ear. And that's so terrifying because it means the problem isn't simple. It's not the easy stuff. It's not wax, it's not fluid, it's not some infection you can see. A totally normal exam points directly to a problem deep inside, with those delicate nerve endings, the sad drummer. It's the very definition of that sensorineural emergency we've been talking about.
All right, so let's say the diagnosis is confirmed. The clock is absolutely ticking. But, and this is a big but, there is still a window of opportunity. So what can be done? What are the medical options on the table to fight back? Well, the first line of defense, the go-to initial treatment, is almost always a short, pretty aggressive course of high-dose oral steroids, like prednisone. The whole idea here is to hammer down any inflammation happening in the inner ear, which is thought to be a major cause, and just give those super delicate hair cells and nerve endings a fighting chance to recover.
But taking steroids by mouth isn't the only game in town. An ENT specialist, that's an ear, nose, and throat doctor, can do something called intratympanic injections. They use a teeny tiny needle to put a high-concentration steroid solution right into the middle ear. So what's the benefit? Well, it delivers a much, much bigger punch exactly where it needs to go without affecting the rest of your body. And get this, for people who don't get better with the pills, these injections can actually improve their odds of hearing recovery by a factor of 6. That's huge. There's another powerful tool in the arsenal too, hyperbaric oxygen therapy, or HBOT. You've probably heard of it. It basically involves sitting in a special pressurized chamber and breathing pure oxygen. The goal is to flood your inner ear with like 10 to 20 times more oxygen than normal to help it heal. And the data shows that adding HBOT on top of the standard steroid treatment can boost the odds of recovery by 2.61 times. Now, it's a pretty intensive therapy for sure, but for a lot of people, it can make a really crucial difference. So, you've gone through the treatments. What happens next? What are the real chances of getting your hearing back? And what does that recovery timeline even look like?
And this right here is exactly why acting fast is so incredibly important. Because if you do nothing, if it's left completely untreated, the prognosis tends to follow a simple rule of thirds. About a third of people will get all their hearing back on their own. Another third will get some of it back, so a partial recovery. But a devastating final third will have no recovery at all, zero. All those treatments we just talked about, they're all designed to shift your odds away from that last terrible category. And that window for recovery is surprisingly short. Within just 1 month, about 90% of patients will have reached whatever their new hearing baseline is going to be. By the 3-month mark, that number jumps to 98%. So what does that mean? It means the hearing you have at 3 months is, for better or worse, probably the hearing you're going to have for the long haul. It just hammers home the incredible urgency of those first few days and weeks. Okay, so let's boil all of this down to 3 key things you absolutely have to remember. Number 1, sudden hearing loss is one of the very few types of nerve damage where you can actually salvage your hearing. That's a big deal. Number 2, you need an urgent, in-person doctor's visit. No excuses. And number 3, that hearing test, the audiogram, is your best friend in this situation. It's the essential tool that gives the green light to start treatment right away. So I'll leave you with this final thought. Now that you know the stakes, now that you know the signs, and that a totally normal-looking ear is actually the most dangerous sign of all, ask yourself this. If your world suddenly went quiet, would you recognize it for the emergency it is? Would you know to act within hours, not days? Because honestly, your answer to that question could make all the difference.